Yeah, we ready? Okay. Good afternoon, everybody. This is the Zoom conference for the Washoe County Board of Health District. And first thing on the agenda, we're going to have a roll call and determine quorum. Susan.
Dr. John Novak,
Here.
Michael Brown,
Here.
Marsha Burke-Bigler is absent. Christopher Dare.
Here.
Dr. Rika Danko is absent. Oscar Delgado.
Here.
Tom Young.
Here.
Chair, we have a quorum.
Good. Thank you very much. Next thing on the agenda, let's have the pledge. Chief Brown.
I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Well, thank you, sir. Okay, next thing on the agenda is public comment. Is there any public comment?
We have none, Chair.
Good, thank you. Moving on, approval of the agenda. You've all been sent the agenda. Is there any additions, corrections, or anything we need to do on the agenda? Hearing none, I guess we'll move on. All in favor?
I'll make a motion to accept the agenda
yeah,
as
we
presented.
did a motion first. Anybody second? Hey, Chris.
Tom Young.
Councilman Dare. Good. Oscar, thank you. All in favor?
Aye.
Aye. Opposed? Hearing none, that passes. We'll work with this agenda. The next thing on the agenda now is the consent agenda. There's a lot of items on the consent agenda this time.
Number 5, recognitions.
Well, that's not what okay. We'll do that. Okay. We'll do with recognitions. Mr. Health Officer.
Thank you, Chair Novak.
That's not what you're.
We're doing our recognitions a little bit differently since they're virtual. We can't have all the staff come in to be recognized, so I'll just run through our list. But we have a number of retirements, so wanted to recognize and thank Susan Duggar for her 18 years of service in air quality management. Lenny Shore, I want to congratulate and thank her for her 17 years of service as a public health nurse. She was a champion for immunizations, so I'm hopeful that she may come back and help us with vaccinations once we have a vaccine available for COVID-19. Scott Baldwin, retired with 14 years of service from air quality, also an air quality specialist. Jackie Gonzalez, retired from CCHS as an advanced practice RN. She was only with the health district about 20 months, but capped off a 37-year career in the medical field. And then also wanted to recognize and congratulate Dr. Todd, our Epicenter director, who retired after 14 years at the Washoe County Health District and a 40-year career in public health. Also want to recognize for years of service, Lilia Sandoval Huffman, 25 years of service with the Health District in CCHS. She's an office assistant too. Cindy Hawks with 20 years with the Health District in EPHP as an office support specialist. And Lori Griffey with 15 years in administrative health services as our admin assistant 1 and our HR rep for the health district. Have a promotion to recognize. Kimberly Graham has been promoted from CCHS to the Administrative Health Services Office from an admin assistant 1 to our new fiscal compliance officer in Administrative Health Services. We have several new hires. Vicki Olson, who is joining EPHP as our EMS coordinator. Lisa Sheritz, who is joining the Health District as a Health Educator 2. This is the new position that we have through SB 263, the vaping bill from the last session that's providing us with tobacco funding for that. Liliana Wilbert, epidemiologist, new position in, or newly joining EPHP. Andrea Esp, who's joining EPHP as our Preparedness and EMS Program Manager. Andrea is a former employee of the Health District in the EMS, or the our hospital prevention or preparedness planning program, coming back to us. Christina Shepard transferred back into the Health District as an advanced practice registered nurse from Human Services Agency to CCHS. Have a few shining star recognition. Wanted to thank all of the staff for their efforts to provide excellent service. We have 707 shining stars for the Health District since the program began in 2017. And we have Teresa Bennett with 10 shining stars that we're recognizing today. And then, are you able to put up Eric Lamun's? There he is. I want to congratulate Eric Lamon, who was recognized by the governor as a Nevada Hero of the Day for his efforts in running the post operations, our drive-through testing facility, and Eric was out also operating a mobile post this morning that we did at a senior living facility that tested over 220 individuals there. I think that Eric would be the first to tell you that this recognition isn't just for him. It's great that he's recognized as a hero, but the work that he does involves the support of everybody on the team and everybody pulling together. So we're very proud of him and for the Health District as well being recognized in this. So that concludes my recognitions. Shall I move on to our proclamation?
Please, I got the updated agenda, so
Okay.
I'm with you. Apologize for people that are watching at home.
All right, we have a proclamation today, and it's recognizing our EMS providers and EMS week. It says, whereas emergency medical services personnel are called upon to help others through one of the most frightening times of their lives, and whereas emergency medical services is a vital public service with personnel ready to provide life-saving care to the community 24 hours a day, 7 days a week, and whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury, and whereas the emergency medical services system consists of men and women in both the public and private sectors, including emergency physicians, emergency nurses, emergency dispatchers, emergency medical technicians, paramedics, firefighters, educators, administrators, volunteers, and others throughout our healthcare system who work together to ensure those in need receive the highest level of emergency service. And whereas the EMS commitment to patient care throughout Northern Nevada has been an integral factor in our safety and security, and whereas Washoe County is proud to have organizations such as Reno Fire Department, Sparks Fire Department, Truckee Meadows Fire Protection District, North Lake Tahoe Fire Protection District, Reno Tahoe Airport Authority Fire Department, Pyramid Lake Fire EMS, Gerlach Volunteer Fire Department, REMSA, and CareFlight operating throughout the region to ensure the highest quality of patient care and community support. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and the accomplishments of emergency medical services providers by designating Emergency Medical Services Week, now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim the week of May 17th through 23rd, 2018 as Emergency Medical Services Week with the theme Beyond the Call in Washoe County, adopted this 28th day of May 2020, signed by Dr. John Novak, Chair.
Thank you. On this, we need a roll acceptance.
I'll make a motion to accept the proclamation as
First,
presented.
Do we have a second?
I'll second that.
Okay, good, thank you. We have a first and a second. All in favor?
Aye.
Opposed? Hearing none, we accept the proclamation, and we really want to take our hats off to all the emergency people. I know it was last week, but things around here are a little bit different than they used to be, so still congratulations to the whole group, so. Now working on the real agenda.
Mr. Chair,
Yes.
Mr. Chair, this is Marcia. I just wanted to let you know I ring on.
Oh, good. Thanks, Marcia. Welcome on. Okay, the consent agenda. Is there anybody that wants to move or pull anything off the agenda? If not, I'll accept the motion to accept the consent agenda.
Mr. Chair, I'll approve the consent agenda as is.
Okay, a second?
I'll second.
Good. First, second. All in favor?
Aye.
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 Opposed? None? Very good. We take the consent agenda, and on the consent agenda, there's some things in there, especially the financial, the subawards are from last week's meeting, or last month's meeting, so that's why there's a little bit more than usual to it, so. The next item on the agenda is, I know Mr. Dow is here, and he will be giving us his report for the next month or two. Dean?
Sorry, I was muted. Good afternoon, Mr. Chairman, members of the board, Dean Dow, President and CEO. So, for the record, you have all received a copy of our March and April compliance reports for your review. And as always, I'm available to try to answer any questions you may have about the reports. In addition, I'd like to briefly share some information about how REMSA has been working to respond to the pandemic across Washoe County region, if I'm allowed to do so. Thank you.
Please do.
Okay, REMSA has and continues to be represented at the incident management team throughout the last many weeks with great representation from Brian Taylor and Kevin Romero from our organization. I'm also very proud to say that our logistics department, which is headed by Josh and Jake Duffy, as we call them here on campus, the Duffy brothers, planned ahead for this pandemic. We actually started looking at this situation back about the middle of January. And those two gentlemen, along with all the people that work in logistics with Josh and Jake, have done a fabulous job and have been able to procure substantial amounts of PPE for our crews, all of our staff employees. In addition, we've been able to, with that hard work on their part, we've been able to donate a little over 2,000 N95 masks to other healthcare facilities, long-term care facilities, and our fire and police department partners throughout the many weeks. REMSA also has expanded access to our nurse health line and grown our capacity on that nurse health line by about 250% to better serve and respond to phone calls from the public, not only in Washoe County, but really truly all over rural Nevada and then parts of northeastern California. Also, with that, the nurse health line sort of in mind, we've also, through a very good partnership with Washoe County and with the health department, REMSA stood up a community triage line in partnership also with the University of Nevada, Reno School of Medicine, where we were able to recruit volunteers from the School of Medicine and other volunteers in the community to staff this phone line 24 hours a day, 7 days a week. And since March 20th, all of those wonderful folks have been able to take over 9,583 phone calls related to healthcare. So everything from COVID to other healthcare related issues. And with the assistance of our nurse health line, they've been able to successfully navigate those patients into proper health care pathways, again, through the last many weeks. REMSA continues to transport COVID-19 positive or suspected positive people experiencing homelessness between testing, care facilities, and temporary housing locations, and again, in a partnership with the county to get those efforts done. We've worked with the health district, also the resort association and the gaming commission to help develop infectious disease protocols and action plans in preparation for June 4th for the reopening of some casino properties. And then since March 17th, REMSA medically trained dispatchers in our communication center have performed more than 2,000 influenza-like illness screenings and communicated that information to first responder agencies across our area and to help in our effort to keep all of those providers safe. And then lastly, REMSA's education department obviously was impacted, as well as all education institutions impacted by this pandemic. We had to shut our classes down. We had to shut classes to the public down, but we very quickly adapted over to virtual instruction and using technology to support continuing education to outside organizations, to employees of this organization, and then also to students. And we're hopeful that the next coming week or so, we'll actually be able to start safely, following some very stringent guidelines for safe to be able to open up our education campus again and start welcoming students back on campus to, if you will, live instruction. So thank you very much for that opportunity.
Good, thank you. We need to accept the 2 months report from REMSA. Do I have a motion to accept?
I'll make a motion to accept.
Good, first. Anybody, second?
Second.
Okay, good, thank you. First, second, all in favor?
Hold on. We, just a discussion on that.
Okay, discuss, please.
Thank you. So I wanted to say thank you for your efforts. I'll tell you what, we have a lot going on, and you guys, I've seen you at the table at each place, and I just want to say it's just awesome to see our REMSA stepping up, and I think it's crucial that you've done that. I do have a question. Has there been federal help at all for what you've been doing now for COVID? Are you keeping track of that? Is that something that it's just going to have to be eaten within the range doing what needs to be done, or is there going to be finances, you think?
We have been successful, and thank you, Councilman Dare, for those questions, and in your thank yous for her participation. We have been successful in, as well as many pre-hospital care organizations, either in the state or nationally, at procuring some levels of financial support. Primarily at this time, it's been through Health and Human Services, has allocated some funding to support the additional expense that all organizations have taken on through this pandemic. So we're watching those efforts very closely. We're engaging with several individuals, congresspeople, others in Washington, D.C., both as an organization and collectively through the American Ambulance Association and the Air Medical Association. So we're hopeful, Councilman, that there will be additional support for all organizations coming down the pike here in the future, perhaps in tranche 4, as they're calling it. But any support we've gotten so far has been massively welcome and truly needed, because as all organizations, fire, law enforcement, all of us, whether you're city, county, whatever the situation, we all know that our expenses have just gone through the roof. And so any help that organizations have gotten has been massively appreciated.
Thank you.
Thank you.
Any other questions, comments? Hearing none, all in favor of the motion?
Aye.
Aye.
Okay, opposed? None? Good, it's passed. Ms. Susie, Dr. Danko's on the, okay. Okay, Ms. Alexa, are you ready?
I am. Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA for the record. You have for your review the Public Relations Report for March and April. And today I will give you an update on a couple of our more recent activities. As you can imagine, nearly all of REMSA's public relations attention lately has been focused on the pandemic. So I'll recap some of the ways we've been working through that. One of those ways is that we've been supporting the region's public health response is through my regular participation in the Joint Information Center and its outreach efforts. This includes assisting with coordination of the first virtual town hall that was held, assisting with the frequently asked questions portion of COVID-19washo.com, graphical messaging, and collaborative messaging with other healthcare partners. While all of the JIC participants contributed in meaningful ways during the initial height of the incident, I'd like to take this moment to recognize the hard work and leadership of the JIC's lead PIO, Adam Mayberry. In addition, I wanted to also mention that I found Washoe County's communications team to be particularly impressive. Everyone was so professional, talented, energetic, and really committed to the proactive and transparent flow of information. I was proud to work among them and call them my colleagues. In addition to the JIC, REMSA has consistently responded to media inquiries and proactively offered up subject matter experts for the pandemic related to the triage line, employee health and wellness, mobile healthcare response throughout Washoe County, PPE, and the importance of continuing to call 911 for medical emergencies. One of REMSA's medically trained dispatch supervisors, Matt Hoth, was interviewed and featured in The Hill, an online and print publication based in Washington, D.C., whose primary audiences are legislators and congressional staffers. The article highlighted the importance of medical dispatchers during the pandemic and the challenges of working in mobile healthcare during a public health emergency. I'm pleased to announce that REMSA has also been able to make some enhancements to its website, including a donation section where individuals, businesses, and philanthropies are able to make cash contributions and arrange in-kind donations. We quickly discovered that this was an important piece to get up and running. And then one additional website feature that we're also very excited about and was launched during EMS week is the Say Thanks section of the website. Both of these are available up at the top of remsahealth.com. And in the Say Thanks section, members of the public can send a message of appreciation to employees across our organization. They'll be shared with a specific provider or staff member if specific details are given, but either way, our clinicians, staff, and the community are able to see these great notes on an ongoing basis. I'm available to answer any questions you might have.
Any questions, comments, or anything else? Hearing none, thank you very much, appreciate it.
Thank you.
Let's move on. Okay. Let's see, item number 9, public hearing on discuss for the adoption of the proposed revisions to the District Board of Health regulations governing air quality management and section prescribed burning. Francisco, you there? Is he muted?
This is Julie. I'm here. Can you see me? I think Francisco's on, but maybe he didn't quite make it. So I'll just jump right in if that's okay.
Oh, please do. Thank you.
Oh, there he is.
Francisco.
Welcome, Julie.
Okay. Good afternoon, Mr. Chairman and members of the board. For the record, Senior Air Quality Specialist with the Air Quality Management Division. So in summary, the prescribed burning regulation was originally a part of the open fire regulation, which was revised and adopted by the board on September 26th. With this 2019. With this revision, the prescribed burning section was removed from the open burning section. So we needed to rewrite this regulation. A summary of the major revisions being proposed are outlined in your staff report. We did hold 3 public workshops. Those were held in January and February this year. We received public comment from 2 individuals, and those comments are also included in your board packet. There will be no changes to the air quality management fees for this prescribed burning regulation change. And staff moves to recommends the district health to move to adopt the regulation revisions.
Okay, any questions, comments? If not, I will take a motion to approve this.
I would move to approve that.
Okay,
And
thank
thank
you.
you guys for the work on that.
Thank you.
Thank you. Commissioner Dare, a second?
I'll second that. That's a lot of work went into this.
Good. Thank
Thank
you,
you.
Mr. Young. All in favor?
Aye.
Aye.
Opposed? None. Good. Carried. Very nice. Thanks for all the hard work on this one. Okay, item number 10 will be COVID-19 emergency response activities. Mr. Kevin, you've kind of been involved. Can you summarize?
Yes, thank you, Dr. Novak. The entire health district, I think, has been pretty heavily engaged with this, along with our regional partners. And I want to say that I've just been so impressed by our health district staff and how remarkable they've been in taking on this challenge. It's a first in our lifetimes event, this worldwide pandemic. And we had plans that had been prepared for influenza pandemic. But I think everybody has heard that your plans only survived at the first encounter with the enemy. So this has been just trying to figure things out as we've gone along and work as a team to take on the challenges that have been presented before us and work together to protect public health in Washoe County. I had explained previously that we had a 3-pronged strategy that we were using that included one, working on our mitigation efforts, the social distancing, and our non-pharmaceutical interventions, since we don't have a vaccine available for this disease. 2, working on the surge capacity with our healthcare system to be able to provide medical care if we had a surge in need for that through our hospitals. And 3 was preparing for crisis standards of care in case our surge exceeded our medical capacity and we didn't have resources available to provide medical care to everybody. Thankfully, the efforts with the first part of that strategy have been successful as far as flattening the curve, and we have not had the surge exceeding hospital capacity. And that's how we've been able to now move forward with the phased reopenings and now entering the phase 2 reopening process. But the health district very quickly had to respond after our first COVID case and the concerns about the Huffaker Elementary School classroom in standing up a post, a point of testing or of sampling for testing, the drive-through testing site that we established originally at the TB clinic and then transitioned over here and expanded for the Reno Livestock Events Center. And that testing initiative requires a lot of other support services for it, in addition to the actual operation of the drive-through testing on the day that occurs. So as REMSA mentioned, they've assisted us with the call center, 24/7 call center. We have established a portal on the website for people to be able to, either in English or Spanish, be able to fill out the risk assessment to be scheduled for testing at the post. We've had the scheduling operation, and we've had the follow-up after testing to provide people with their test results. And then we have the contact case investigation and contact tracing that happens when we do have the positive cases, so that we can isolate them and we can identify their contacts so they can be quarantined to prevent the spread of the disease. We also have worked while we were responding to this emergency with Acela to build a platform for electronic platform for being able to manage some of the call center scheduling and results reporting activities involved in the response. The org chart that we've got up on the screen provides an example of the structure that we've built through the health branch for this response. It's fairly extensive, as you can see, and a lot of thought has gone into how this is organized, and it's evolved over time. And I would say that's really what's happened with our total response. We've worked to figure out how to do something and learn from our experience and try to continuously improve.
Yep, I'm sorry to interrupt. Can you put that on the screen? I'm looking through my notes. I don't see that. I just want to make sure I'm seeing what you see.
Is there a way to do that? To
It's
share?
not, it's not in your notes. Hold
Is there
on
a way
minute.
to do a share screen on?
Thank you.
Okay. And can you still hear me okay?
Yeah.
Good. So this is our org chart for the health branch, and so it's basically set up under the incident command system, and we have a number of different units that are operating under our branch director, which Charlene Albee and Jim English have done an incredible job as the director and deputy director, and Wes Rubio as well in supporting them. And then we have the REMSA branch, and as Mr. Dow mentioned, Brian Taylor has been, and Kevin Romero have been involved with that. Brian Taylor is there daily at our briefings and health branch meetings in the morning. We have a National Guard branch with Lieutenant Orr that's leading the Guard contingent that has stepped in and helped us with the post and the associated activities through contact tracing there. We have Tyler Henderson and Eric Lamont who are leading our health district field ops with the post deployment. And we have the planning section that's led by Dan Inouye. Francisco Vega was involved with leading that for quite a while. That updates the plans for our continued response. We have the public health preparedness unit with Andrea Esp leading that, with coordination with the hospitals and with our volunteers. We have our medical coordination branch. Amber English and Latricia Lord have done a heavy lift with quite extensive group of people working under them through the call center, our EPI team on the case investigations, the disease investigation, and then also our statisticians working on surveillance and data. Dawn Spinola has led the logistics unit. Anna Hina and Nancy Kearns coming with the finance unit for the response. And then you see we also have a number of individuals that are engaged in the liaisons for homeless, government, working with the City of Reno and Washoe County, and as well as safety and security with the county. The Human Services branch, I would mention that Julia Ratty also served as the director of the Homeless Services branch for a few months until that was merged with the Human Services. And Scott Oxerard has done a phenomenal job as our communications manager, working with the JIC and the extensive communications that have occurred pretty much on a daily basis as we've worked through the response. As far as the regional response, we were operating under a unified command structure, and Aaron Keniston is the incident commander that's leading that. As the board will recall, you approved the delegation of authority in the interlocal agreement that was between Reno, Sparks, Washoe County, and the Health District at the March meeting. And today, in the consent agenda, you approved the amendment to the interlocal agreement to change the incident commander from Sam Hicks, who did an excellent job in leading the initial phase of the response, to Aaron Keniston, the Washoe County Emergency Manager, who's now leading that incident command. This has been a prolonged incident and response, and it's going to be continuing for the foreseeable future. And so it's been quite an experience, different than wildfires and flooding that I've been involved with before. But this is where we're working to try to pace ourselves and be able to continue in the long haul for this. We've been fortunate with the National Guard joining us and integrating into our operations. I can tell you that our post and all of our operations, from the call center through the contact tracing, have been viewed as a model by the state, and we have Guard members that come through here for training and then go out to do posts in rural communities, to do training of those local county government people on how to conduct contact tracing, et cetera. So I think our efforts have not only supported Washoe County, but have supported the rest of the state as well. We currently are working on work plans and budgets to receive the federal funding through the Paycheck Protection Program. That, along with some other remaining CARES funding, is going to provide about $10 million of funding for the health district that will help us with staffing for the post operations and that call center through contact tracing effort moving forward as the National Guard steps down. The date that the Guard is stepping down is currently set for June 24th, but the governor earlier today tweeted that there are plans being made for the Guard to remain deployed until August. So we're hopeful that that will come to fruition, because losing the Guard is going to really harm our response effort at this time, as we're working on getting those longer-term staffing for those positions. The other wild card that's in play is whether the National Guard will stick with some previous plans, which was to provide for a 14-day quarantine period for Guard members as they're stepping down. And so it could be that they'll apply that period during the deployment, in which case we could lose the Guard on June 10th. So we've got fingers crossed we'll get some news soon that the Guard will remain deployed, hopefully until August as we move forward. Also, as far as plans moving forward, I mentioned that today we conducted a mobile post at a senior living facility. So we have as priorities for populations that we want to be doing testing for, of course, our symptomatic individuals, but also our vulnerable populations, long-term care facilities, senior living, congregate settings, and our high-risk workforce, first responders, and healthcare providers as priority populations that we need to be testing, and testing with some frequency. We have also announced and are opening up our drive-through testing post next week, June 1st through 6th, to test people that want to be tested that are asymptomatic. This is something that we're doing in conjunction with a statewide initiative from the governor's office to provide these testing events for asymptomatic individuals. So we'll see what the response is to that. And we're working on a seroprevalence study that I'm sure people have seen in the news that we've been communicating on. And it's a research project that's in conjunction with researchers at the UNR School of Epidemiology and the Nevada State Public Health Lab that will use the antibody test that the state lab has validated. It's the Abbott antibody test. It's one that's very reliable with 100% sensitivity and 99.6% specificity. So it's useful for us to be able to test a randomly selected and representative sample of individuals from households, randomly selected in 173 census tracts across the county, to be able to provide us with 95% confidence, if we can achieve enough people responding, of what percent of the Washoe County population has been exposed to COVID-19 over the course of this outbreak here and have developed antibodies to the disease. So there's quite a lot going on in our response. Situations change rapidly throughout as we get new information and new developments. So we'll continue to adjust as we need to as we move forward. But I've been talking for a while. There's a lot of areas to this, so I'll open it up if people have specific questions or areas that they want to further discuss.
Any questions for our health officer?
I have a couple questions.
Go ahead, please.
Thank you, sir. One is I wanted to know in the fall, if there's another wave, just kind of what are we doing to prepare, look forward, if that's the case. I know we have a lot of current infrastructure that we've kind of built for what we need. And just what is the thought? I mean, obviously the last thing we can probably handle economically is another shutdown in the sense of that. But what do you foresee? What do you think? And how are we handling that? That's one of my questions. I do have a second one, but you might answer that.
So that's an excellent question, Councilman Dare. There has been a lot of discussion about potentially a surge happening in the fall. Whether we see a huge increase in COVID cases or not, it's going to get a lot more complicated as we have the influenza season coming back around. And in that season of people having the influenza-like illness symptoms as they get from the flu, as they get from other viral respiratory diseases and from COVID-19. So we anticipate that we will see increased demand for the testing as we move forward with that. And we have one of the reasons for opening up the post for the asymptomatic testing next week is to basically stress test our system a little bit for being able to manage that capacity. And so that includes not just the testing, but the contact response and contact tracing that goes along with that. The state is working with some of that, the Paycheck Protection Program funding actually it's separate funding from the state they're using, to contract with a vendor that will provide us with a platform that all of the local health authorities can use that will help support that contact tracing effort. I mentioned we'd worked with Acela and had developed a system with them that streamlines the call center through the test result reporting back to individuals. This will help us with more automation of the contact tracing and make that more efficient. The other piece of that is that contract will also include the vendor providing contact tracing staff that can be used by entities across the state. So we're basically working on a two-tiered system where we will have that increased staffing that we'll be doing through the health district for our contact tracing group. And then through this contract that the state is developing, we've got a backstop of additional contact tracing capacity that will be available as we if we need to, as we surge. The hospitals are also preparing for potential for a future surge. As you're aware, the Renown built out 700 additional beds in their parking structure that they're not utilizing, but they're maintaining that facility in case it's needed. in the future. So I think it's comforting to know that we've got that care capacity backstop as well. And then also we're coordinating with Immunize Nevada and working on plans for how we can enhance the delivery and getting people to get vaccinated with the influenza vaccine as we get to the flu season. So hopefully we can reduce with that the number of people that may have those influenza-like symptoms from the flu and keep them out of the pool of people that we need to be tested for COVID.
Good. Any other questions, comments?
I have one more question that I want to throw out there. So the antibody testing, we have a lot of people that ask. I know you can't mess up a test you're doing by just letting anybody. Is there going to be a time when you think that we're going to let people find out if we get tested to see if they ever had this thing? Because maybe it's just interest. I don't think it could potentially help our number, help us to know. But I know, like I said, there's quite a few people who ask me all the time if they could get tested with the antibody. And I've told them no because of the thing, but is there ever a time when this is over you think that's a good idea, or?
So right now, the state labs antibody testing is limited to testing that's for public health purposes, for surveillance to identify what level of exposure our overall population or perhaps segments of our population may have been exposed to COVID-19 and develop the antibodies. I think as far as people that want to get the antibody test, I think that that's something that will be available to them through the private sector and their healthcare providers in the future. I would caution people about rushing out now to get the antibody test. I know people are doing it, but there are a lot of tests out there that are not very reliable. And I'm hopeful that as we proceed through this, we're able to identify which tests are the ones that work, and that the commercial labs will be operating using those tests. But as far as the public health role in this, I see that primarily as being able to identify people that have COVID-19 so they can properly be isolated and their close contacts quarantined, or to do those types of surveillance studies to identify what the prevalence is as far as exposure to COVID-19 across the community.
Thank you.
Chris, one thing I want to follow up on your question there. In the last couple days, there's been almost 200 different serology tests sent off to the CDC for approval, and only about 12 have actually been approved because of their specificity and stuff. People, if they really want one, can get it through commercial labs like Quorum, stuff like that. But at this point, I was just in this conversation this morning, I cannot find out what LabCorp tests they're doing, if it's a really approved one through the CDC. And I really recommend, if you tell somebody about that, to really encourage them to get a test that's a CDC approved test. And the one we're running here, the Abbott test, it's not the rapid one you hear about on the news, but this is another test through Abbott that is just very, very, very accurate on what we're doing. So I just pass that on to anybody that asks for a serology test. So, okay, thanks. Anything else? Good, moving right along. Tom, did you need something? Okay.
No.
Okay, good. We're going to accept a report from the Health Fund Financial Review for April fiscal year.
Mr. Chair, I'm sorry to interrupt. It does appear that the last item was an action item as well.
Oh,
on
okay,
accepting
I'm
the
sorry.
report.
Then we need a motion to accept Kevin's report.
This is Brown. I'll make a motion to accept the report.
A second?
I'll second.
A second, thank you. All in favor?
Aye.
Opposed?
Aye.
Good, thank you. Okay, very good. Thank you for the prompt. Okay. Anna, are you on? Is she muted? Can you fill in for that?
I think Anna was planning on being on.
Ms. Heenan, are you there? Okay.
It's connecting?
Okay, can we move on to staff reports? And if she gets on, will you let us know, please? Okay. Moving along for the staff reports for air quality management. Francisco, are you still there?
I'm here, Chair Novak. Can you guys hear me?
Yes, sir.
Perfect. I apologize about the previous technical difficulties. There may or may not have been some user error associated with that, so I apologize for that.
Totally understand, but you had a great fill-in, so.
Yes, I did. Thank you. For the record, Francisco Vega, Director of the Air Quality Management Division. I don't have anything to add beyond what has been communicated in the staff report, but I'd be more than happy to answer any questions.
Okay. Any questions, comments?
I have one question here for you too. Is I was just wondering, has our air quality improved since the shutdown has actually occurred?
Yeah, that's a really good question, and one to answer kind of, or difficult to answer kind of directly, just because there are so many factors associated with the air that we monitor. Temperature obviously takes into account, other meteorological kind of factors that go into that. So it's really difficult to kind of make a direct comparison between kind of 1 year to the next. In general, the air quality in Washoe County is in attainment with the ambient air quality standards. And because of that, we don't see the drastic changes that you might see, you know, in areas such as like Los Angeles and things like that. But I think the best thing I can tell you is that at this point, the air is doing well, and it is in attainment with the ambient air quality standards.
Good.
Thank you.
Any
Thanks.
other questions? Okay. Thank you, Mr. Vega.
Mr. Chair?
Yes.
Anna was having difficulties. There might have been a problem with her connection, but she's going to actually come over here to make sure.
Okay, that's
Give her
great.
report.
Love to have her. Okay. Moving on, Ms. Lafritz, are you there? Community Health Services, Ms. Lisa. Connection problem? Is she muted?
Charlene thinks they're all muted by the meeting. I don't think that's what's showing up.
Ha! Ta-da. Yo, please.
No closer than 6 feet.
You're good.
Can I talk here?
Please.
Forgive me, sorry, I sprinted over.
No.
I was
Thank you for
trying
stopping
to,
by.
Stop you before you closed out item 10.
Do you want to
Because-
stop and take a breath?
I'm good. Because I did want to give some updates on the fiscal, if that's okay. All right. Looking at the overall impact, and again, forgive me, the Unified Command has actually spent, I just checked the numbers, my report had 9 million encumbered. We're actually at about 7.5 million. They've done some revisions on purchases, and we were able to take it down. Those costs in Unified Command will actually be shared by Washoe County, City of Sparks, and the City of Reno. The Health District will not have to pay anything, so that's good news. But for the Health District, we actually have spent about a little over $1 million right now for costs that will not be reimbursed by the grants. We have several million on the grants. So from this point, we've got $931,000 that has actually been accepted for grant funding, and we're working on another 11 million that's going to help us do that contact tracing and the call center. But to let you know the overall impact for the health fund, we're not sure of the overall impact, obviously, because it's only been a couple of months, But given what has been going on, I had looked at my new forecasting for COVID event, and I compared it to the information I brought to you in February. What we're looking at right now is our revenues for fiscal year 20 are actually going to come in at about $275,000 less than what I reported to you in February. Roll that forward into FY 21. We're looking at about a $2 million loss in revenues for FY 21. So we can cover that for a while with our fund balance, but the fact of the matter is we are going to have to reduce some expenditures. And Kevin, if you had gone through these, forgive me, I also had my phone hang out too, so we're having problems upstairs.
I have.
No, we did not
Did not.
sneak in
Perfect.
information at all.
Okay, so to be able to cover some of the loss in revenue that we're experiencing, we are in a hiring freeze right now. The non-mission critical positions are not going to be filled. We are also looking at the non-critical mission expenditures. Those will be frozen. For next year, the $500,000 that we had set aside for community support projects, that will have to be held off for the year. And then our behavioral health injury prevention program that you guys did approve in February is going to be put on hold. We haven't filled those positions, so we're going to freeze those for now. We also are looking at having to reduce other services and supplies. The chemicals for the mosquito abatement program, we're going to have to cut that in about half of what was budgeted. However, with talking with the program manager for Vector, we have enough inventory to do the abatement program for the rest of this year, calendar year, and then we'll reassess where we're at early next year. So, but we're going to try to save some money there. The lawnmower rebate program for our air quality division was brought forward to you. We're going to put a hold on that for right now. That's paid for with restricted funds, but we may need those restricted funds to cover labor if we continue at the pace we're going. So that's another thing we're going to be keeping an eye on. So right now, like I said, we do have some fund balance that can help cover that, but we are faced with, given all those freezes, if our revenues continue to decline the way we're seeing them declining right now, we're going to have to come up with another $1 million in cuts before FY 22. So it's something that I'm going to be reporting to you monthly now from here on out so that we can make sure we stay on top of this. We have heard from the county management that they're asking employees to give up their COLA that's supposed to start July 1. So far, that hasn't been voted on. They're working through it. The health district does not have control over those negotiations. So we will monitor the situation and we will get back to you on what the decision is with that. However, in my forecast, I did keep the COLA in and I came up with savings through attrition. We're looking at the COLA's cost was about $375,000 and an average FTE position is about $114,000. So that's 3 positions. So if we can continue to do some freezes and not jeopardize the employees' pay that are that we have, then that's what we would prefer. However, again, we don't have control over those negotiations. So that's the end of my update. I'm happy to answer any questions. I'm not sure what item we're on, but
It's okay.
okay. Sorry again.
No, thank you for rushing over here. We
Sure.
appreciate that. Few technical difficulties. Any questions for Ms. Heenan? Are we still on?
I was going to say, sure, now that I can breathe again. I don't have any questions.
Chris, are you still there? They're all muted. I can see it up there.
There's no sound is what they're, I think they need to be readmitted maybe to the meeting.
Anna?
Well, we're muted at the very
Good
bottom.
report, they didn't hear.
There you go.
It's muted at the bottom.
I said the feed
Hello,
just,
can you hear me?
Now we can hear you. Okay, you're, okay, one. Oscar?
I can hear you, I can't hear whoever was talking before.
We can hear you now. You came back online.
Okay, good, thank you.
When did you lose us?
Did you hear Ms. Heenan's report? Tom?
Can you guys hear Charlene now?
I can now.
Yes.
Again?
Okay, apparently we have to put *6 if we want to be able to be heard, and I wasn't aware of that until just about 2 seconds ago.
Lisa Lodger, I'm here as well. I don't know if you can hear me now. I did the *6 as well. Can you hear me?
Yes, ma'am.
Yes, I can, Lisa.
Okay.
Yeah, I can hear you all too.
It seems that our board chair might have frozen up, so you can't hear him, it seems. They're on, can't hear them.
Okay, heard Chris. Tom, can you hear?
They can't hear
Are we muted at the bottom there? Bottom left-hand corner shows mute.
I would continue the meeting, but we don't even have a quorum now. You know?
This apparently is our new normal.
They can't hear us.
It seems like Oscar just keeps smiling no matter what happens.
So can you hear us now, Chris?
Chris, can you hear?
I know you're my friend, Chris. That's why.
Yeah, they can't hear us.
I am, it's just a great smile. That's all. I was just checking if you're there, buddy. He froze up. He lost that big guy.
Do you want me to do some?
Still a good picture, though.
I broke mine.
Oh,
Why do you
yeah.
want me to touch this?
Dania, do we have to stop?
If we can't get the quorum back,
Okay.
we'll just have to stop
That's
the
kinda
meeting where we ended.
It would be nice thing it was farther.
We
than
just
that.
need one more, right?
So Charlene says they can't see us now either.
Where are you going?
Can you take a look at it?
If I hit that. Can you hear us now, anyone?
Again?
Oh,
That's
yeah,
better.
That's what happened.
Okay, I'll be back.
All right.
We at least have 4.
Can you see us and hear us?
We can now.
Yes.
All right.
Okay.
We already completed the meeting, don't worry about it.
Well, it was a fun meeting. Thanks a lot for coming. So, no, we're good. Marcia, you still there?
I am, I'm right here.
Okay, good. No, we're just kind of,
So
Dr. Danko, are you around? I can see you got some of them muted already.
No, I don't mute them, they mute themselves.
Okay. Tom, can you hear us and see us now?
Yes, I can.
Okay, good. No, it shows a little bit differently up there, so. Did you hear Anna Heenan's report?
Most of it.
Okay, how far? To the start, just the finish? How far, where did we lose you?
Seemed like halfway through.
Okay, you didn't hear the conclusions?
No conclusions.
Okay. Can you kind of pick up halfway through?
Sure.
Okay. She's breathing normally from the run, so we're going to try to rerun half of it, so.
Okay. Well, you know what? I'll just recap real fast.
Okay?
I'll just get straight to the health fund impact due to COVID. In February, we brought to you our budget. What we're looking at right now is the information that was given to you. We actually are going to be about $275,000 less in the revenues that we thought we were going to end the year with. And going into FY21, we're projecting that we're going to be $2 million less than what we had presented to you in February. So given the loss of revenue, we actually have imposed a spending freeze. We are holding non-mission critical positions that are vacant, frozen, and again, not spending expenditures. The $500,000 in our community support is going to be suspended for the year. We will not be spending that. And our behavioral health injury prevention program that was approved in February is going to be put on hold for now. We have not filled those positions, so we're going to hold off. We also are looking at reducing
Hang on,
our
Charlene
chemical.
says they've lost us again.
Do we still have you? We don't have
We
faces
lost everything.
either.
Christopher's talking.
Up and see if you actually are wearing pants that match your suit.
We can see you, Dean.
Making fun of us.
I'm not gonna stand up. I don't wanna scare anybody.
Are we back, John? We lost you again.
Okay.
Yeah, I don't know what's going on.
Well, we can see and hear you again for the time being.
Okay, I'll move fast. We're gonna reduce our chemical supply funding for the mosquito abatement program. We do have enough inventory to finish out this summer, so we'll be okay on that. Our lawnmower rebate program is gonna be put on hold for right now. That's in the air quality division. We need to make sure that we have enough funding to cover our positions before we move forward with the rebate program. And then, of course, we're gonna be looking at all of our service and supplies for reducing that. Our fund balance is going to get us through for a while, but if our revenues continue to decline the way we're projecting them and seeing them decline right now, we will have to come up with another $1 million before we go into FY22. So I will be bringing this information back to you monthly and keeping an eye on it so that we can make decisions quickly and not wait until the very last minute. One thing to note, the county has asked the employees, our employees are part of the Washoe County Employees Association. They've asked them to give up the COLA for FY21, which starts July 1. It's a 2.5% increase. That has not been voted on. We do not control those negotiations, so that will be up to the county, but we will continue to monitor you of that situation. My projections included the COLA. It got salary savings through attrition and holding vacant positions frozen. So, but again, we will be bringing that information back to you. We have spent, I'm not sure if y'all caught this part, about $1.1 million out of our fund on COVID that is not gonna be reimbursed by grants, but we did receive about a $931,000 grant that's gonna cover costs, and we're waiting on another $11 million that we've been promised, but we're working out the budget and we're waiting for those grant awards to actually come to us. Then we're pretty much guaranteed once we get those awards. So, I think that was it. Any questions?
Mr. Chairman, if I could just give an update for
Sure.
everybody. Got a text from Scott Oxerard, our communications manager, and he said that the internet at the county complex went out for about 30 seconds.
Oh, good.
And so that's what caused the issue. We are, recording and videoing this meeting, and that all continued. So we have
Good.
all of that. So.
Okay.
I do have a couple questions.
Are you done? Okay, good. Go ahead. Dr. Danko can hear us, but she can't. Obviously, we can't hear her, so she's around.
Kevin, this might be directed to you, but I do know that we particularly did pull a lot of staff to make sure we were ready for COVID-19. We've been doing all kinds of, you've been trying to cover and stretch and do whatever, but as we open up, it's pretty obvious that we hired everyone for other jobs and jobs that have to be done, whether it's visiting restaurants or whatever that is. And we can't hire anybody else, obviously the hiring freeze. It just realistically, how manageable is it what we were talking about doing in this next short time? That's my first question.
Okay, I can respond to that. So right now, Councilman Dare, with the guard that's joined us, and we've gotten, we're building 30 more over the last week or so. We had some additional folks come in today that are getting trained. We're working to pull some of the redeployed staff out of the incident response to get them back into their normal duties. And as we are able to get the funding from the federal funding and are building up our staffing that we're going to do with short-term temporary staffing, that will cover the incident response activities, and we'll be able to the plan is to pull those other remaining staff back into their duties to be able to provide those public health services that our community needs moving forward. I would also add that With the decline in revenue that we're anticipating that we do have businesses that are not going to survive this economically. And so I anticipate that we will have opportunities for downsizing through attrition with staff. I think that our staffing need in some areas may be less in the next few years than it has been over the past few.
Gotcha. My other question, thank you for that. That's just something I think we need to make sure we're really keeping communication to the rest of each of our partners of what we're doing, and especially in the midst of this, remind them, because we just have a lot that the health board, the health district does across the whole valley in all different ways, and so just kind of keeping that in front of everybody would be wise, I think. The other thing is, one of the things that most cities and everyone, at least we're doing, I'm sure everyone's doing, is we are definitely looking at COLAs, but also potential percentage decrease for a time for, and I know you mentioned that you're not in charge of that at all, but like, I don't know, there's potential in the city of Sparks, so there might be a small percentage decrease of pay while we get through this hard time. Are any of those things something you're looking at or not yet, or what are you thinking of that?
So I'll take that one. It's not something that I've heard discussed yet through the county manager's office and HR, and they're really the lead for the negotiations with the employee associations. But I would say that it's probably not out of the realm of possibility. It is. There were concessions that were made during the recession that happened to 2008, 2009 time period. And so that it has been done before, and it may be something that's utilized for this as well.
It might be wise, in my thought, and I know it's in their jurisdiction, but there's nothing wrong with us submitting what we'd hope for. Because if you don't submit anything, then we're just kind of stuck with whatever comes up with. But if you can play out what might work in a worse, in a difficult situation, that might be wise to give them a hopeful plan or something, so at least you're in the conversation. And when, again, I not that I don't trust the county. I mean, obviously they're going to do what they need to do regardless, but sometimes it's just helpful as we lead to have the idea what could work for you and that kind of thing, a laid out plan.
Understood. Thank you.
Anything else? Okay. And that's possible action item, so we have to accept the report. Anybody?
Chairman, may I say one more thing before
Sure,
we close
please.
out? Real quick, and it kind of goes in line with the org chart that was shown earlier, and the fact that we are moving our staff back to their old jobs, if you will. I think it's important because it was a matter of timing. One critical component of our logistics for the COVID-19 was an individual called Luke Franklin. He's a senior environmental health specialist. Up until this week, he was on logistics, and he was very instrumental in helping us do a whole lot of supply ordering and setting up the current location for what this new COVID-19 epi team is going to be dealing with and working in. So he's been deployed back to his old business. The work that he does in environmental health is going to help bring in the revenue. So he's a perfect example of he went to help with the COVID team, now he's going back, and we're going to gradually try to get people back to their old jobs so we can start bringing in the revenue. But I wanted to make sure that Luke Franklin was recognized also, because he just got removed from the org chart this week. So thank you.
Good, thank you.
I'm done.
Anything else?
If I could add on to that too.
Sure,
I think,
go right ahead.
I'd be remiss if we also didn't recognize the county and the efforts that they've made to provide space for us as we've brought in additional people. So we have a huge area in Building C that is now housing call center and contact tracing personnel. And we also have had additional space in Building D that used to be the Truckee Meadows Fire Protection District space that they've made available as well for the call center. So they've been tremendous in working with us and tech services with getting all of the computers set up for those workstations, et cetera.
That's good.
Thanks.
Okay, we need to accept Ms. Heenan's report. Hear motion?
Brown, I'll make a motion to accept the report as presented, and thank you, Anna, for running over and making that happen.
A second?
Al? And thank you for doing it 4 times. Appreciate it.
Thank you. First and second. All in favor?
Aye.
Opposed? Motion carries. Thank you. We accept your report. Thank you, Miss Anna. Okay. We left off. Ms. Lottridge, are you still there?
I am here. Can you hear me?
Yes, ma'am. Go right ahead.
Oh, great. Yay. Lisa Lottridge, Division Director for Community and Clinical Health Services. Just an update with our programs. We have been operating all of our clinics and services throughout the COVID response with just some adjustments. WIC has been offering televisit or visits over the phone, so we don't have any WIC clients coming into the office, but all of the WIC services are still being offered to the clients. But as far as family planning, sexual health, TB, immunizations, everything has been continued through this response with just some adaptation. I do not have anything to add to my report, but I'm happy to answer any questions you might have.
Any questions, comments? Good. Thank you very much for the report. Moving right along, let's see where we are. Environmental health. Charlene, are you there?
I am here. Can you guys hear me?
Yes, ma'am. Please go ahead.
All right. So environmental health obviously has been very busy working in the COVID response. Just to point to Councilman Darris' comments about staffing, environmental health has 44.9 full-time employees, and at one point we were down to 3 to 4 employees were the only ones that are available in EHS. Everybody else had been deployed to the COVID response. The priorities that we set were to make sure that we responded to complaints, because that's a number one. There's a current imminent need to get those addressed. As we've gotten through the first few months of this, and as we're saying, starting to transition some people back as things are opening, we have set priorities for continuing to respond to complaints, to do inspections that are the most high risk, so the Category 3 restaurants. We're looking at doing some daycares and the schools, which are supposed to be inspected twice a year. We lost the spring semester, so we will be making sure that each of them get inspected in the fall semester. And then we have come up with a reopening plan for the pools, which is pretty highly publicized. We've been trying to get it out. Regulations require that each of the pools has a certified pool operator. We are going to be relying on those operators to send in a document verifying that they are in compliance and that they've checked all of their systems and requirements before they open. Once we receive those in, we'll know who's open, and then we can start getting those inspections done as we move forward. And with the staff that we have, we had a staff meeting this morning, and everybody wanted to know what expectations were. And I said the expectations are is that we will be effective and we will be efficient and we will get as much done as we possibly can with what we've got to work with. So that really is where we're at and where we're going. So other than that, we will continue our operations in the COVID response and be as supportive as we can on both sides of the fence that we seem to be working on right now.
Good.
I'm available if anybody has any questions.
Any questions, comments? Okay. Thank you, Ms. Albee. Moving right along. Ms. Epps, are you there?
This is Andrea. Can you hear me?
Yes, ma'am.
All right. So good afternoon, Chair and members of the board. Andrea S., Acting Division Director for Epidemiology and Public Health Preparedness. I do not have anything to add to the staff report, but I am available if you have any questions.
Any questions and comments for her? Glad to have you back. Thank you. Okay, Mr. Dick, it is your turn.
Thank you, Mr. Chair. The Office of the District Health Officer has been fairly fully engaged with the COVID response. I'm very proud of my team for how they've stepped up to contribute with the response. Joelle Gutman with government liaison activities that have been critical as we've been moving through this. Also working with the Nevada Resort Association and others. Julia Ratty, who, as I mentioned, was leading the homeless services branch, and then numerous other staff, well, I guess all the remaining staff, Susie Valdespan, Rayona Dixon, Felisa Hilliard, all helping with the contact tracing activities, reporting out results from testing. Susie's been instrumental with Spanish speakers and translation as we've moved through here, so everybody has been fully engaged in the response. I'm sorry, I think I said Rayona Dixon. It's Rayona Lavoie now. I should be getting that into my head. But she also has taken a leadership role with leading EPI team of contact tracers and investigators in that contact tracing group. So I want to acknowledge all of their efforts, and also that this has meant that we have not, we basically have suspended most of our activities through the Community Health Improvement Plan. The Community Health Needs Assessment, we were scheduled to do that this year. Our accreditation requires that happen every 5 years. We had previously decided we were going to do that in conjunction with Renown on a 3-year schedule, but it's just not feasible for us, and we have a few more years that we can get that done. And the other quality improvement, workforce development initiatives, et cetera, have really all been put on hold while we're mobilized for this response. That's my report.
Good. Any questions, answers for Mr. Dick? Okay. Hearing none, I think we're ready to move on. To the next section is board comments. Anything for kind of the good of the group, anything you want on the next agenda, now's the time. Hearing none?
Yes.
Yeah, go ahead.
I just want to encourage, I know we have a lot of things going on, and so staff-wise, first of all, I think it's just important to hear from us that we are definitely trying to keep up with everything. This is an amazing, I say amazing, not necessarily good, but difficult time. And I think we've done an amazing thing of trying to help push through. Kevin, you've done a good job of keeping things rolling. I know that things get crunchy working with all the different entities at times, but we just keep pushing forward. But I do think it's also very important that we have our meetings. And I just want to say each month we encourage us that we keep on track. Part of it's just communication to us. I think it's good for staff to be aware that we are cheering them on, but I think it's good for our community too. So thank you for having that this time. I know staff-wise, sometimes it's hard because everyone's busy, and to put these together take extra time, but I think it's crucial. So thank you.
Good. Anybody else? Okay. This is kind of my time to say a few things. Yesterday, I was very honored to be able to talk at the call-in staff meeting we had for our entire staff. I really want to thank our entire staff for being flexible. One day you walk in and find out your job is not this, it's something totally different, and your hours may be endless, but boy, we've done a heck of a job, and we've been noticed by the state for what we're doing and how well we're doing it. So special thanks. I want to recognize a few people, not necessarily everybody. REMSA has stepped up in numerous ways, and we totally appreciate that. The coming in of the National Guard and their time and stuff like that it's been a saving grace to us. We couldn't have done it without the Guard, and we hope they're going to be around for a while. I want to thank Eric Brown, the County Commissioner, and the entire County Commission itself. It's been a really trying time for everybody trying to adapt to everything, and the pressures that everybody has heard from the Resort Association, everybody out there, everybody wants to get open, but we still have to do it safely, and they've really been working hard with us, and especially Eric Brown has been really a good contact for us. Want to thank the managers, the city managers that talk to Kevin every day, and he's trying to keep everybody on the same page, and it's just a moving target every time you pick up the phone. So I want to thank them for being there all the time. I want to mention that we really appreciate everything Dr. Todd has done for us for all the 14 years he's been here, staying above and beyond, and we wish him the best in retirement. I want to thank Kevin for all the hard work, numerous hours he's put in. We talk, 2 or 3 times a day sometimes. I know most of the time he probably doesn't want to hear us, but we're there anyway for us. He's been quite a leader, stuck his ground. We've had lots of advice and everything brought for him from all directions, and he's stayed the course. I want to thank our Chief Brown for being there. Mike and I, as you all know, Mike's the vice chair, and we never talk more than, 2 times a day over something that's going on. So I want to thank all that. And lastly, I really just, again, want to thank all the health department staff for doing it. We will have another one of these wonderful Zoom meetings, probably June 25th, in the ultimate social distancing. So when you leave your meeting, you can put your mask back on that we all have, and it's not just a disguise. So that's it. Anything for public comment?
We don't have public comment.
Good, good. Moving right along, that's number 14 is public comment. Number last is adjournment. We will see you at the end of June. Sorry for some of the technical difficulties, but that just goes along with everything else right now. So see you all in June.